Hi, my name is Elizabeth Rodriguez. I'm a registered nurse working at a cancer center in New York City. Cancer treatment education is defined as a 1-hour session that's provided by a registered nurse in advance of receiving therapy for the cancer. That 1-hour session can include both verbal information provided by the nurse and written materials that can help augment the education provided. Although research shows that this type of education can be very important to improving the quality of life for patients and reducing the number of visits that a patient may need to have to a doctor's office or an emergency room, and possibly even admissions to the hospital, nurses face many challenges to providing this type of education. To help illustrate this point, I'd like to introduce you to two nurses that work at this major cancer center and have them describe to you the type of education they provide to patients and in turn the challenges that they face when trying to provide the comprehensive education that these patients truly need. First, let me introduce you to Sarah Henderson. She's a registered nurse and she is oncology certified.
So my name is Sarah and I work as a registered nurse in the outpatient setting with lung cancer patients. My role as a nurse in the clinic is to help educate patients about the chemotherapy regimens that they're going to receive, as well as their disease, the treatment for their disease, and potential side effects that they're going to get. The majority of patients have a terminal illness, and they're aware of that on some level. And so they present to the clinic with high anxiety, and so often as a nurse you're juggling many things, both psychosocially and also it's complex in the sense of pathophysiology and helping educate them about what is their disease and what is drink. We spend a lot of time educating patients up front because we want them to be successful, and we want to minimize the impact on their quality of life and maximize the effect of the drug. And so that's not always a simple equation. A lot of times it's more of an art. It's a science, because we're limited by time in the outpatient setting and we see a high volume of patients. We don't have as much time as we'd like to spend with the patients, and this limits the depth of education that we can provide. And the end of the day, at times you feel like you've barely scratched the surface because of the volume of patients that you're required to see. So when we educate patients up front about the effects of chemotherapy and the effects of their disease and how it may change over time, things to expect, often this decreases the amount of visits needed to the emergency room. It can decrease the costs associated with healthcare because you're educating patients and giving them tools to prevent crisis.
Now, let me introduce you to Ann Culkin. She's also a registered nurse who is oncology certified and works in these outpatient clinics. Listen to her story.
My name is Ann Culkin. I'm an office practice nurse here in a collaborative thoracic oncology practice at Memorial Sloan Kettering Cancer Center. I am a registered nurse. A cancer diagnosis is a multi-system disease. Just my specialty happens to be lung cancer. That being said, lung cancer is a disease which affects the entire body. And when you're educating patients about their disease, you're educating them about their entire body systems. Why? Because of the complications that can come just from having a diagnosis of cancer. Therefore, we begin with the basics, understanding what the person knows and their caregivers know, as well as what questions they may have up front. From there, we move on to a way to teach the patient, most of which is written in language understandable for those patients. So a great example of a patient not understanding, for instance, in drug therapy, the side effect profile. A drug, for instance, it's just like vinorelbine or navalbine, if you will. The major side effect of that drug is constipation. So if a patient doesn't understand that the drug they're going to get to treat their cancer is going to cause constipation, perhaps that patient then doesn't follow through on prevention of constipation. Therefore, the patient ends up in pain, if you will, unable to eat, unable to drink, maybe perhaps vomiting, and they end up in your urgent care center or an emergency room for what could turn out to be the $10,000 enema with abdominal film x-rays, again, coordination of care, perhaps admission to an institution, all for what we believe is a simple, preventable side effect of a drug. Again, the line, you have to know when to hold them and know when to fold them, comes really into play because as the office practice nurse, I'm part of a collaborative practice, so I also know that I have maybe 7 more patients to be seen very similar to the one that's sitting in front of me. So you try to grasp just how much time you're going to need to appropriate to this particular patient and family. You have noise factors. You have perhaps that the next patient is ready to come into your room and you have to then move out of the room. Many of our education, unfortunately, occurs in a waiting room area, which is not private. Space is a huge challenge. Time is a huge challenge, allotting the amount of time that is necessary. As we grow older in a society here in the United States, we are faced with geriatric oncology patients, and there are multiple challenges. Another group of patients that we see quite here at this center are the international patients, or even multiple minority and diverse population of patients. The English is not their primary language. So we have to find resources of education materials and how to begin to treat those patients and educate those patients. We are challenged daily with appropriating time, resources, language, understanding, and getting through the barriers that could prevent you from patients understanding a cancer diagnosis.
In this time of economic downturn, President Obama has spoken about improving the quality of health care. Making these amendments to Medicare would support these type of changes. If we improve the quality of the education we provide to patients, the outcomes from their cancer treatment will also improve. Patients will experience better quality of life, reduced side effects, and reduced admissions to the hospital and the emergency room. I'd like to thank you for listening to this very important message, and I want to urge you to support this important legislation that will amend Medicare to provide reimbursement for this nursing education for cancer patients.